The diagnostic technique used to detect congenital anomalies in uterus is A. Alpha fetoprotein, B. Amniocentesis, C. Chorionic villus sampling, D. All of the above. And the correct answer is D. All of the above. Because alpha fetoprotein, amniocentesis and chorionic villus sampling are the diagnostic technique used to detect congenital anomalies in uterus. If alpha fetoprotein is down, child develop Down syndrome, and if alpha fetoprotein is increased, child develop neural tube defect. Amniocentesis is process in which amniotic fluid is aspirated and alpha fetoprotein level is checked. Chorionic villus sampling also required to detect congenital anomalies. White or yellowish white secretions that last for 10 to 15 days after the delivery called A. Lochia rubra, B. Lochia serosa, C. Lochia alba, D. All of the above. And the correct answer is C. Lochia alba. Lochia means first fortnight vaginal discharges after delivery of child. First fortnight means first 14 days. Now there is three types of lochia: lochia rubra, lochia serosa, lochia alba, each for 5 days. Lochia rubra is of dark red color, lochia serosa is of pinkish brownish of color, and lochia alba shows yellowish white in color. Failure of descent of one or both testes at birth in newborn is called A. Phimosis, B. Hydrocele, C. Cryptorchidism, D. All of the above. And the correct answer is C. Cryptorchidism. A male child has two testes in his scrotum, but during intrauterine life, both testes are present in child's abdominal cavity. At 33 weeks of gestation, first right testis descent in the scrotum and second testis descent at 36 weeks of gestation. Now some child's testis not descends for some reason. This condition called undescended testis or hidden testis or cryptorchidism. To correct this cryptorchidism, the orchidoplasty surgery is done to pull down the testis into the scrotum. Transmission of maternal antibodies to unborn child through the placenta is an example of A. Active immunity, B. Passive immunity, C. Humoral immunity, D. Herd immunity. And the correct answer is B. Passive immunity. There are two types of immunity: innate immunity and acquired immunity. Innate immunity is already present in the body, and acquired immunity is further divided into two types: active acquired immunity and passive acquired immunity. Active acquired immunity is activated after exposure of antigen. Active acquired immunity again divided into two. One is natural active acquired immunity and second is artificial active acquired immunity. In natural acquired immunity, it is developed after exposure any disease and antibodies are developed. And in artificially acquired immunity, and antigens are entered through a vaccine and immunity is developed. But in passive acquired immunity means immunity achieved directly through the antibodies. It is also divided in the natural and artificial. In passively acquired immunity, child receives antibodies through placenta and breast milk. Through placenta, child receives IgG antibodies, and through breast milk, IgA antibodies are received by the child. So above mentioned options, option B, active acquired immunity, is the correct answer. A woman's serum and urine test will be positive for HCG in all the following conditions except A. Pregnancy, B. Ectopic pregnancy, C. Vesicular mole, D. Post-hysterectomy. And the correct answer is D. Post-hysterectomy. In above mentioned options like pregnancy, ectopic pregnancy and vascular mole are the conditions which are created after only fertilization. So hormonal level of HCG will be high in serum and urine during these situations. But hysterectomy is surgical procedure to remove the uterus. So post hysterectomy situations never cause production of HCG or any hormones. HCG means human chorionic gonadotropin hormone and it is secreted by syncytotrophoblast. Syncytotrophoblast is the place in uterus where fertilized ovum is implanted. Syncytotrophoblast secretes HCG hormone. The client has clear drainage from the nose and ears after the head injury. How can the nurse determine if the drainage is CSF? A. Measure the pH of fluid. B. Measure the specific gravity of the fluid. C. Test for glucose. D. Test for chlorides. And the correct answer is C. Test for glucose. Client has clear drainage from the nose and ears after the head injury. Check glucose for this fluid. Because glucose is present always in blood and CSF. If it is other secretions then the CSF, sugar will not be there as result. So option C, test for glucose will be the correct answer. Normal glucose range in CSF is 45 to 90 mg per dl. CSF is the fluid of central nervous system. It means CSF is a part of brain and spinal cord and it protects the brain and spinal cord. There are three layers surrounding the brain and spinal cord. From inner to outer, these are pyometer, arachnoid and durometer. There is subarachnoid space between pyometer and arachnoid layer, and CSF is found in this space, which is formed in ventricles in the brain. Which drug would be the least effective in lowering a client's serum potassium level? A. Aluminum hydroxide. B. Glucose and insulin. B. Polystyrene sulfonate. D. Calcium gluconate. And the correct answer is A. Aluminum hydroxide. In option B, insulin causes to decrease serum potassium level, but it also causes to low glucose level also. So insulin is given along with glucose. Insulin decreases the serum potassium level by shifting potassium from plasma to plasma cells. In option C, which is polystyrene sulfonate, also lower the potassium level through binding potassium in intestine and excrete out from body. Polystyrene sulfonate, also known as K-bind, available in powder form and given orally. In option D, calcium gluconate acts as antidote of potassium and it decreases the cardiac toxicity of serum potassium. So drug in option E and C are given in case of hyperkalemia, but option A, aluminum hydroxide, has nothing to do in case of hyperkalemia. That's why option A is correct answer. Aluminum hydroxide is used as antacid in case of hyperphosphatemia. The main component of essential newborn care are the following except A. Resuscitation of newborn with hypoxia. B. Prevention of hypothermia. C. Prevention of infection. D. Prevention of behavioral problem. And the correct answer is D. Prevention of behavioral problem. Resuscitating the newborn with hypoxia, preventing hypothermia and infection are the main component of essential newborn care, but prevention of behavioral problem of newborn is not an emergency. It can be solved later. Recommended volume expander for a newborn in shock. A. 5 ml per kg of normal saline. B. 10 ml per kg of normal saline. C. 15 ml per kg of normal saline. D. 20 ml per kg of normal saline. And the correct answer is B. 10 ml per kg of normal saline. The most commonly shock occurs in a newborn is hypovolemic shock. Now in case of hypovolemic shock, the fluid of choice is normal saline 0.9% and it is isotonic solution. This fluid amount in newborn is 10 ml per kg of body weight.